towards the next part in the X-ray tube, that is grid. So what is the function of grid? First of all, grid lies between the patient and the cassette. What this grid do? It restricts the particular direction, restrict the X-ray which are moving in particular direction or which is not in alignment of that grid. So what is the need to block these X-rays? Okay, so first let us move towards this image. So there are some blue colored parallel X-rays. These parallel X-rays are hitting the patient and it is causing the shadowing of that patient, which is in particular proportion as that of the patient. But what happens when there is oblique X-rays like these green ones, or here we have the red ones? So the patient is like this, and since we are getting an oblique X-ray hitting the patient, it is causing the shadowing here as well. Besides the patient's normal shadow, it causes the shadowing or it causes the blurring of image. So what is our work? Our work is to block these oblique X-rays. So when we put a grid is basically a multiple parallel arrangement of leads, columns of lead, and these parallel arrangements of this column allows only the perpendicular rays to pass through it. The rays which are perpendicular to this parallel to this grid pattern are allowed. So in this way, this red colors and this green color, the diagonal X-rays are blocked and only parallel rays are coming. So we get the proper imaging. There is no magnification, no blurring of image. So in this way, we increase the quality of the image. But the drawback of this grid is that since some of the X-rays are been blocked, there is decrease in sensitivity of the X-ray. So when you put a grid, you have to somewhat intensify the exposure of X-ray. So in this way, you get a proper imaging and there is no magnification, no blurring of anything. So this is the function of grid. Now let us move towards the cassette. So in cassette, we have two things. The first one is our screen and the second one is our film. So let us see about the screen first. So on what principle this screen works? It works on the principle of phosphorescence. So it works on the principle of phosphorescence. So what do you mean by phosphorescence? The phosphorescence means emission of light or emission of photon without any type of combustion, burning or heating. Any heating up of the substance. So this is the principle of phosphorescence, and this screen is made up of calcium tungsten. So how the screen works? Let us see in this image. So you are getting your X-rays like this. The X-rays are crossing the grid, which means the X-rays are parallel to each other. When this ray of photon hits the screen, see it is hitting over the screen over here. It causes the phosphorescence of the screen, causing release of numerous photons, and this numerous photon causes the activation of this film, silver bromide. So what happens? A single hitting of photon or single hitting of X-ray beam causing the production of numerous photons, and this numerous photon causes the activation of this film. So what happens? The sensitivity of the film of the silver bromide to the X-ray increases, right? In this way, we get a proper or better imaging. So this is the function of screen. You get a proper and intensified image of everything. Now let us move towards the film. So film is made up of silver bromide. So the screen works on development and then the fixing of screen. So it is developed with the help of hydroquinones and phenidine, and it is fixed by hyposodium thiosulfate. Right? Now let us move towards the types of film, or what all types of film available in the market. So the film we have are of two types. The first one is the single coated, and then we have a double coated. So what do you mean by single coated film? So this is considering this is a cassette, we have our film above it. This is our film. This is a single coated film. And suppose this is our cassette, it has a screen above and it has a screen below. So what is the advantage and disadvantage of single and double coated film, and where are those used? So let us see what happens whenever an X-ray hits this double coated film. I'll take it in black. Whenever the X-ray hits this double coated film, it causes activation of both films. So what happens? Small amount of X-ray causes activation of both films, so we get the proper image. But the point is, since there are two screens activating, and there is difference in the there can be a deviation of X-ray when it crosses from one medium to other. So there can be somewhat blurring of image, but the image is useful for investigation. The image is useful, but what's the advantage here is that small amount of exposure can give you better image. Okay, there can be somewhat blurring or magnification, but that is very insignificant. It does not affect any of your diagnosis. So in normal X-rays like chest X-rays or dental X-rays, right, or digital imaging, in dental X-rays, that's it. On orthopedic X-ray, double coated films are used. Okay, so now let us move towards the single coated films. When the X-ray hits this single coated film, there is activation of only one film. Okay, so if there is less amount of X-ray, you get somewhat low quality image as compared to double coated X-ray, because there is activation of only one film. So to get a proper imaging in one film, single coated X-rays, you have to intensify the X-ray hitting the film. So in normal practice we do not use it. We use it in high-end imaging like CT scan, MRI or digital imaging. So in this cases we use this single coated film, right? Now let us move towards the special X-ray tube. So the special X-ray tube, these are the exceptions. We are going to see this in deep in further lectures of mammography, but just cover it here for the sake of MCQ. So this specialist of mammography, right? What do you mean by mammography? Breast radiogram or a radiogram of, wait a minute, I will write it down properly. Radiograph of breast. So in this mammography, what happens? In normal X-ray, the target is made up of tungsten. Here it is made up of molybdenum. M for molybdenum, M for mammography. Then the filter window, the target window. Sorry. Right. This should not be a filter. Yeah, right. The filter. In normal cases, the filter is made up of aluminium, but here it is made up of molybdenum. M for molybdenum, M for mammography. Then the target window through which the X-ray exits. Normally it is made up of glass or pyrex. Here it is made up of beryllium. B for beryllium, B for breast. So these are the exceptions. We are going to see these exceptions in detail, but I am just covering here for the MCQ. Now let us move toward the film focus distance. What should be the distance between the source of X-ray and the film away from it? So normally the distance between this source and the film is 100 centimeter. Sorry, 100 meters. 100 centimeters too less. 100 meters. Right? But in case of it has exception obviously. So in case of chest X-ray, we are having the distance as 180 meters, that is equal to 6 feet. The reason for is that because after the 6 feet the X-rays are parallel. Here they are divergent, but here they are parallel to each other. So because of this parallel X-ray, there is not cardio magnification, there is no increase in the size of heart, which is because of the divergent X-ray. Can you relate this with the ophthalmic, that when you put a snail's chart, you put it 6 meters away from